This conference will now be recorded.
Welcome in, everybody. Today we're going to be talking about prefabricated splints. So I have a patient, they fell off a ladder. They fell about 6 to 7 feet. The patient's complaining of left ankle pain, left wrist pain. I have conducted my general impression. My scene size up, the scene is safe. I got my BSI on. My patient's alert and oriented. Airway, breathing, circulation is proper and controlled. I have isolated injuries. Because of that fall, I'm going to still go ahead and do my rapid and detailed trauma assessment, identifying any other types of immediate life threats. I've done that, and again, I have isolated injuries specifically to the left ankle and specifically to the left wrist. So I'm going to use my prefabricated splints to go ahead and apply my stability for those injuries. As mentioned in the introduction to splints, they have a wide variety of different sizes of your prefabricated splints. So this one is specific to a lower leg injury, specifically to the ankle. The other one is specific to a hand and wrist. I have larger ones in the event that the patient's complaining of pain up and down their entire leg, where I can go ahead and stabilize that specific. So I'm going to check CMS. And what I'm going to do is I'm going to try and slide that underneath the patient. Okay, I got their ankle captured, and then I'm going to go ahead, wrap that around, and then secure it in place. Okay, I got a nice fit. There's no big void spaces at all, and then I'm going to go ahead and reassess CMS. Okay, so the pulse. Can you feel me touching you? What toe am I touching? And then go ahead and wiggle your toes. Patient wiggles their toes. Good. Perfect. Now, I'm going to secure patient's left wrist. So open that up. My partner might be able to assist with this. Nice and gentle. Wrap that around your patient and go ahead and secure it in place with your Velcro straps. Okay, I got that attached. Go ahead and check CMS. I'm checking for a pulse. Which finger am I touching? Go ahead and wiggle your fingers. Now I'm going to reassess my pain evaluation. So let's say the patient was complaining of pain at an 8 out of 10, both the ankle and both the wrist. Then I'm going to go ahead and ask them what their pain value is now that we went ahead and applied those splints. With any splinting application, don't forget about pain management. So cold packs, ice packs, go ahead and apply that to the extremity. Certain splints isn't going to allow really good surface area for cooling that site, but these are actually nice that you can apply cold packs and you're going to be able to get some type of pain management effects. Once you get to the hospital, the doctor is going to go ahead and remove those splints. They'll decontaminate them, and then they'll apply that, put them in the EMS supply closet for you to take on your next round to that specific hospital. So remember too, as far as securing the patient above and below that specific joint. So with the wrist, that's a joint, so it's secured relatively above and below with this splint, same with the ankle. But anytime that we have a larger surface area, and every time we're splinting the arm, go ahead and utilize our sling and swath technique here to ensure that that arm is not moving around. And then I can go ahead and also tie the patient's legs together too. And that way I'm securing more and more. And I can do that with a triangular bandage or a couple of triangular bandages. All right, thanks everybody. Those are prefabricated splints. Don't forget you have a variety of different sizes that you can utilize for different types of injuries.